A second unvaccinated child has died in Texas after contracting measles. The death comes as there are nearly now 500 known measles cases at this point in West Texas. It keeps getting worse. Several other states have also confirmed cases, as well as New York and New Jersey. Joining us now to break this all down and some other health headlines is Dr. Lipi, founder of CEDA-Med. Thanks so much for being back with us.
Great to see you, Bianca.
So let's talk about the measles first, because we're seeing this in West Texas, but this is something we should worry about here.
Yeah, so as of this morning, there were 600 confirmed measles cases across the United States and across 22 states. The vast majority, as you pointed out, almost 500, about 480 or so, have been in Texas. And sadly, including 60 hospitalizations and, as you pointed out, the deaths of 2 children, a 6-year-old and an 8-year-old girl. I really want your viewers to understand that measles is a highly contagious viral illness. We don't have treatment. Like, there's no antiviral treatment like we did say for COVID-19.
Sure.
The only most effective way to prevent it is through prevention, and that's the MMR vaccine. 2 doses, really highly effective. And remember, measles is not just a common cold. It can cause severe complications, so including bronchitis, pneumonia, ear infections, and encephalitis, which is brain damage.
And what we're looking at right here on the screen there is just like a bunch of bumps, red bumps, inflamed bumps on
Absolutely.
bumps.
What people mostly think of with measles, they think of the rash, a very common, what we call coplic rash, which happens after the initial cough and a cold-like symptoms. But it's that rash and then other complications that can really be serious. What's really concerning, though, to me, because you asked, is it relevant to New York and New Jersey? Luckily, the vast majority of people here are vaccinated, unlike in Texas. But the problem is that what's happening is that people in leadership positions with no medical training, like RFK, who are holding federal positions like HHS leadership, he needs to really be very clear and hold an assertive stance that vaccines are safe and parents need to vaccinate their children. If he had done that very clearly, I'm pretty sure that those 2 girls in Texas would be in their classrooms and not in coffins. Medical professionals are very concerned and frankly outraged.
Let's talk about something else, a whooping cough. We're seeing maybe an outbreak from this. Obviously, this is something we talk about every single year, but what's the latest on that? Yeah,
so whooping cough, also known as pertussis, like measles, also a highly contagious acute respiratory infection. Unlike measles, whooping cough caused by a bacteria, Bordetella pertussis, initially, it looks like it's the common cold, but 1 or 2 weeks later, you can develop violent coughing fits, known as, and characterized by this whooping sound, which is when a patient is gasping for air between coughs.
Yeah, and it's certainly scary for young children.
Yeah.
But speaking about adults, before you go, I know we're running out of time here. Alcohol Awareness Month, that's this month, and a lot of people are drinking less, so what's your take on it?
Yes, I'm so glad you're talking about this, Bianca. April is Alcohol Awareness Month. As you know, my day job, I'm an addiction medicine doctor. There's 30 million people in the United States with a diagnosed alcohol use disorder. The good news is, and it can increase your risk of cancer over 60%. Alcohol-related mortality is increasing among women. But here's the good news: most people with alcohol addiction, once connected to the appropriate treatment recovery services, can get better. Medications like naltrexone and behavioral therapies and counseling.
Ozempic too, actually.
I was just going to get some of the good news. Yes, so naltrexone behavioral therapies are really effective. Supportive services and AA can also be helpful. But the good news, as you point out, Gen Z is actually drinking less. They're into the sober curious movement, and Ozempic, Wegovy, these obesity medications are showing promise in reducing cravings. So there's good news.
Very interesting, Dr. Lipi. I always appreciate you being here and giving us some insight on what's really happening behind the scenes. Thanks so much. All right, stay tuned. We've got more news straight ahead. Stay with us.